Lovely. Well, welcome everyone to this very short, but I'm sure very interesting report out. I had a brief kind of preview of this a few weeks ago when we had an executive stand-up. So I'm really interested to see how this event's gone with the very catchy "Get Our Kit Back." That comes through as almost swear words missing out of that, isn't there? But anyway, get our kit back. So I'm not sure who's leading.
I'll start. So good morning, everyone. No, good afternoon, everyone. I'm Rachel Bickerdike, and I've been one of the team leads for this Kaizen event. We had 2 days with a team this week on Tuesday and Wednesday. We don't have the full team with us today, but we still wanted to share the fantastic work that's been done this week. So this has been part of the sustainability piece of work to reduce, reuse and recycle across the trust, but we're particularly looking at mobility aids, which is Zimmer frames, crutches, walking sticks that are issued to patients. They're issued all over the trust, but there is no current system to return them. Sometimes they arrive at the hospital at various locations, but they could end up anywhere, and quite often staff don't know what to do with them, and then a lot of them end up in the skip. So we were looking at ways to just get them back. First of all, we could have gone much wider with the scope of this. But first of all, we just wanted to start with, let's get them back. So this was our project form. This was the defining bit, the scope of the problem from, and we decided to focus at minor injuries unit in the LGI because Emily will explain why we chose that area, but it was crutches issued in minor injuries. So from them receiving the walking aid to then sort of no longer needing them and hopefully returning them. So they were currently not being returned. There was no formal process, but we wanted to look at what we could do as small tests of change to try and get some back.
Hello, my name's Emily Hinchley and I am the process owner for this Kaizen event. This slide picks some photographs that have been taken from various places in the hospital. You notice there's a cage full of crutches that would have been perfectly reusable but signposted for the skip. The top right picture of Zimmer frames were actually collected by a consultant from various charity shops and then deposited in the physio department. Despite this huge accumulation of kit around the hospital sites, minor injuries are currently spending just shy of £3,000 a month on walking aids. And the recent figures that have come through this morning is that the trust annual spend on walking aids for last year was £39,474. I also managed to get some patient feedback through social media asking anybody that was issued some crutches by a Leeds emergency department in the last 3 years, were you told what to do with it when you no longer needed it? And 95% of the patients said no. General consensus also from public feedback was frustration that it was a huge waste of NHS money. So this is our busy process map showing where an aid could be issued from, and then what happens when the aid leaves the hospital, which is very different if a patient doesn't return to one of our hospitals for an outpatient service. It also is completely different if it's issued from a different site to the LGI. Even the walking aids that are then returned through an outpatient clinic, there's then no standard process for getting the returned aids cleaned and repurposed so that they can be reissued. Our target progress report, our baseline cost then is the minor injuries spend of 2,737, and our target we set at 500. This is because we do expect there'll still be some cost. Obviously, you have to referral the crutches to make them be able to be reused, and then we would likely get replacements that we can't reuse that would be recycled by the sustainability team. Quality and defects, we looked at the percentage of items that have returned to minor injuries, which we believe to be 0%, and we want 100% returns. Our other quality defects was that patients aren't given instructions to return the aids once they're issued them in minor injuries, and we want 100% of patients to be told to return them. And from a service point of view, we would like to see that 100% of patients are happy with the return information once they're given an aid, which we believe is currently 0%.
Hi, good afternoon. I'm Matthew Quintenham. I'm one of the team members for this event. As my colleagues have already mentioned, we decided to concentrate on minor injuries and was starting to conduct our trial there. What we did was we actually engaged in a brainstorming exercise on how are we going to get these walking aids back. This generated 24 team ideas. Some were quite out there. I mean, we started with creating an advertising campaign, either by poster, radio, potentially the advert break during Emmerdale. Develop training sessions to be included at staff aids. This could then potentially be extended to training and awareness sessions at the corporate induction for staff. Walking aids to have QR codes, so simply scan the code, gives you all the details on where to return. What we did agree, though, that in order for this project to succeed, there would need to be designated drop-off points throughout our estate. Okay, so the trust actually currently uses the 770 drop front litre wheelie bins. For ease of access for the public to bring the aids back, we were thinking they would have to be external drop-off points. This would then generate the issue of security, weatherproofing, making it flame retardant, but also being able to house a movable receptacle such as the 770. So this is just a quick rough idea of a sketch for a solid-sided casing to house the bin. Very similar to what you have with your closed charity bins, the opening. Once you've put the walking aid in, it can't be taken out to prevent theft. But also for ease of logistics, the bin can then be removed and replaced by our transport team.
So myself and Matt Powell went to the Gemba to ask patients for their feedback, and the overall favoured preferred location was Clarendon Wing entrance, with 8 out of 10 people being asked, would you find a returns collection here useful, saying yes. And there was also a higher footfall of patients that were carrying a walking aid there compared to Jubilee. A lot of the fracture clinics and outpatient clinics happen in Clarendon as opposed to Jubilee. We then also asked the question, if you were returning your crutches, where would you like to drop them off, keeping it broad? The majority said a doctor's surgery, but because our scope focused on site, the next was the LGI, Leeds General Infirmary. Whilst we appreciate this is a small group of patients we've looked at the LGI, we would need to repeat this at St James's and the other sites.
Okay, as a starting point to get the message out, the team, we developed a poster. This poster is now on display in the minor injuries unit reception area and on the walls in the bays where the patients are actually handed their walking aids. The minor injuries team has also been briefed that when giving out a set of crutches to patients, they are to tell them that we would like them back once they're no longer required and that they can actually return them to the unit for further use. Okay, this is, sorry about that, what we then did, there is no actual process. So once these items have been returned to the unit, how are we actually going to get them back and record them? For this process, crutch comes back to the unit. Once they've received 10 units in the IMU, they contact physio. Jobs raised on carts, so our facilities colleagues will come and collect, bring back over to physio. MIU notify physio that the number of items have been sent, and then once we're back, physio record the details on a data sheet so we can actually start gaining the data and what's coming back in.
So our action log for the Kaizen event. So Matthew is going to be looking at the approval for a collection bin, and then also getting cost estimates from a fabricator for a bin design, which we're going to aim for by the end of this month. There were no visual controls in MIU, but we've got the posters up now, and Rachel Hall with the MIU staff, we're going to test 8 weeks to see how many crutches are returned there. And the other problem being that there was no process for cleaning. Lorna Williams and Rachel Hall are also going to test a standard work between minor injuries and physio, cleaning them. And we've got 8 weeks on that, which will be the 5th of June.
Okay, the next steps of how we could actually broaden this the scope of this project, liaise with the other departments within the Leeds clinical teams who also distribute walking aids. with all the relevant stakeholders, the fire team, security, car parking, our facilities colleagues. Also to branch out to the Leeds City Council and see if we could operate using their collection points, be it their municipal recycling centres, also the City Council units. As Emily's already previously mentioned, contacting our local supermarkets, Morrison's, Asda, Tesco's and Sainsbury's. Also liaising with the GPs and healthcare centres, which our transport team already currently visit. And one other one, we would also explore what sort of CO2 saving we would be looking to generate and maintain to work towards our net zero target for 2040.
Thanks, Matthew. Yeah, so just to say thank you, big thanks to the team members that couldn't be on Report Out today, so Lorna, Rachel and Matt. Also to Sophie Williams, who was a co-team lead with me from the KPO team, and Tom Dayton from the KPO team, who joined us for a part of the Kaizen event. Amina Hanzadeh was the sponsor for us from Adult Therapy, so thank you to her for supporting this piece of work going forward, and for Jane and Kirsten to release staff from minor injuries and support this piece of work from the ED point of view. And then massive thanks to everyone at Minor Injuries for listening to us, asking questions and interrupting them, and for being part of a team that's now going to test this. So yeah, that concludes our report out.
I think that's brilliant. I'm just wondering how many, do we know how many walking aids are out in the wild? You know,
it was very difficult for us to collect the data because we have anecdotal evidence that they're in people's garages, in lofts, in charity shops all over. So we didn't know. And Emily found a few with like Sheffield stickers on, or you know, they're all over the place.
Yeah. No, and it does just feel so wasteful when you look at it like that. It just seems so horribly wasteful, doesn't it? I mean, yes, in money terms, but just in sort of resources that we're producing this stuff and just sending them out. And so I think a fantastic piece of work really plays into the 7 commitments that we've got this year, or you know, particularly one on sustainability. So thank you for all the work on that. I think it was like a great start and great progress after a few days, and look forward to seeing your next report. Are you going to do a 30-day or a 60-day? Is that the plan?
We're going to do 60-day because the test is 8 weeks, so that'll give us enough time to see what's happened at minor injuries.
Brilliant. I look forward to seeing you in 60 days then. Thank you, everyone.